Robert F. Kennedy Jr. wants to make America healthy again. But how unhealthy is the United States really? We decided to give the country a bit of a health check and see how it compares to other similar nations. We're going to show you the data on life expectancy, cause of death, and healthcare spending. And we'll have a look at the potential solutions being suggested by Kennedy and others. So let's get started by trying to measure America's health. Kennedy, often known as RFK Jr., has called the United States the sickest nation in the world. To figure out how sick it actually is, life expectancy is a good place to start. And it's not a pretty picture. In this analysis by KFF, a nonprofit health policy research organization, the average life expectancy in the US over the last 43 years is shown in red. The blue line is the average life expectancy in 11 similar wealthy nations such as Australia, France, Japan, and Sweden. According to this analysis, US life expectancy at birth in 2023 was 78.4 years. That's about 4 years shorter than the average of the other countries they looked at. This gap wasn't always so wide. Americans' life expectancy was gradually improving, thanks in part to a drop in smoking and the wider use of cholesterol-lowering drugs called statins. But these improvements gradually slowed, plateauing in the 2010s, even as things got better elsewhere. Analyzing death data helps explain why US life expectancy is relatively low. This reveals the biggest difference in death rates has been in people aged 15 to 49. Among these younger people, the death rate has been falling much more slowly in the United States than in other comparable countries. And because young deaths erase more years of life than older ones, they drag down overall life expectancy. Here you can see the data for just 2023 with the death rates by age for the US in red and comparable countries in gray, with blue being the average. For younger people, the death rate in the US is at points more than 3 times higher. So America isn't very healthy, at least as far as life expectancy goes. But why? Kennedy has said that the United States has the highest rate of chronic disease, and chronic conditions are one of his big targets. The KFF estimates that Americans are about twice as likely to die from cardiovascular disease before reaching 70 than people in similar countries. Overall, chronic conditions, heart disease, cancer, stroke, and respiratory diseases take up 4 out of 5 spots in the country's list of biggest killers. One factor that might be contributing to both the low life expectancy and high rates of chronic conditions is healthcare. Compared with a group of similar high-income countries, the United States is the only one that lacks universal health insurance coverage. According to public health experts, lack of health insurance, high costs, and other barriers prevent people from getting diagnoses and treatment early on. The other big contributors to lower life expectancy in the United States, and what researchers say really sets the country apart, are high death rates from substance misuse, car crashes, suicide, and homicide. Here you can see the deaths from these causes in the US compared again to similar countries, in this case focusing just on people aged 15 to 49. Car crashes kill a large number of Americans, partly because they tend to spend proportionally more time driving and in bigger cars than people in many other nations. Then there's suicide and homicide. Gun deaths account for about 80% of US murders and 55% of suicides. This led former US Surgeon General Vivek Murthy to call gun violence a public health crisis in 2024. And a major factor, deaths from substance misuse, are unusually high in the US, down mainly to the opioid crisis. Looking again at younger people in the US, a recent calculation suggests that 1 out of every 25-year-olds, or roughly 1 in every school class, will die before the age of 45. The comparable figure is 1 in 50 in the United Kingdom and 1 in 100 in Switzerland. The United States' relatively poor life expectancy exists despite disproportionately high spending on healthcare. In 2023, this was about $13,000 per person, compared to an average of about $7,000 in similar well-off countries. Kennedy has used this poor return on investment to justify some cost-cutting and layoffs at the Department of Health and Human Services, which he leads. Meanwhile, a sweeping spending bill signed into law in July is predicted to cause about 12 million more people to lose health insurance by 2034, largely owing to cuts to Medicaid, the federal health insurance system that covers some people with low incomes. Kennedy's critics say this and many other moves could worsen US health. Instead, some experts propose that boosting rather than cutting spending on disease prevention could lead to big public health gains. Others suggest expanding health coverage in a country where 8% of people lack health insurance. Tackling high death rates from overdoses and guns, meanwhile, would involve addressing entrenched social and political issues. For these, there will be no quick fixes. So Kennedy might be right about the state of US health, but it remains to be seen whether his solutions will indeed make America healthy again, or whether they could make it worse.